From Denver's 7, this is 7 News. Tonight on the 10:15 difference.
What's keeping me from walking is this lower belly. I can't carry it. It's just so heavy.
The amount of skin and fat we're proposing to remove is at least 20 to 25 pounds.
See the amazing results tonight on 7 News at 10.
Well, as you just saw, a woman trucker used to love the open road, and now she finds herself confined to a wheelchair, unable to work, unable to walk.
They told me that I needed to get out of the truck and lose the weight, and then I could go back to work. And when I got out of the truck, at that point I knew I couldn't walk any longer.
Nearly 4 years ago, Sandy Fuller's weight reached an all-time high of nearly 500 pounds, and it forced her to stop working because she no longer could get in and out of the truck on her own. But now, after gastric bypass surgery and the dramatic loss of 120 pounds, Sandy has decided to have another surgery, and the hope this time is to get her life back.
Joining us this morning is the doctor who performed this life-changing plastic surgery, Dr. Philippe Capraro. He is from Grossman Plastic Surgery. Thanks for being with us.
Thank you for having me.
Dramatic pictures we just saw and a dramatic story. Tell us more about Sandy's case and what you had to do with her.
Well, with Sandy's case, she had lost over 120 pounds from the gastric bypass procedure. And what she ended up with was a large quantity of excess skin and fat, basically an apron down her lower abdomen that reached all the way down to her knees.
Oh, wow.
And because of that, she couldn't walk. She couldn't get up and really walk, things that you and I do and take for granted every single day.
That's a lot of excess baggage. What are the difficulties in doing a procedure like this?
Well, it's a large quantity of skin. Now, when she had the gastric bypass procedure, a lot of her morbidities or comorbidities that she had improved. So they are actually a lot healthier several months or a year after their gastric bypass procedure. The key to this surgery is to try to do it in a few hours and to try to remove as much skin as we possibly can in a safe manner.
Now, I know all the different extremities will have extra skin, right? But they continue, patients who undergo gastric bypass surgery continue to lose weight. So are they going to have surgery after surgery after surgery?
To a certain degree they do. You can imagine that she was extremely large. Her skin had stretched so much that the laxity was immense. And then she lost 120 pounds over a year. The skin couldn't catch up and retract at that rate. So she has an excess amount of skin. Her tone was lost. And so we try to remove as much skin as we can, but if she's going to lose some more weight, she may very well need to have another procedure, probably to a lesser degree.
Just like people who have a facelift may have to go back for a tune-up facelift.
Absolutely.
Now, talk to us a little bit about, you mentioned being under time constraints. You have to work quickly because?
Well, the case usually lasts about 4 to 5 hours, but you can imagine the amount of weight that we remove, and we want to make sure that we don't lose that much blood, because it is a very, very large incision in terms of the length of incision, and the amount of tissue we're removing is great. So we want to be working in a timely fashion.
And it's actually, you go all the way around her midsection, lots of scarring, I'm sure.
In her case, what we did is a paniculectomy, and a panis is basically removal of excess skin and fat from the lower abdomen. So in her case, I basically went from one hip to the next hip. I didn't go all the way around.
Okay.
And it's something that she may want to consider in the future.
Well, we certainly wish her a lot of luck. Can you fill our viewers in on how much a procedure or a series of procedures that she is going through is going to cost? What is the range? You don't have to be specific.
Sure. In this patient, because this was a functional problem, it's not a cosmetic problem.
Very big distinction.
Which is a big distinction. Insurance generally will cover it, but it can range in the range of about $10,000 to $15,000 for the operating room fee, the doctor's fee, the anesthesia, and so forth.
Okay. But as you mentioned, this obviously the gastric bypass surgery helps not only just with their physical appearance, but it helps their health overall?
It's not only a physical help that we're giving her, it's a psychological help. She will be able to get out of her wheelchair. She'll be able to walk where before she couldn't do it for the past 4 years.
You know what? We are going to show viewers how they can see the outcome of Sandy's situation. You can watch the amazing results of Sandy Fuller's life-changing plastic surgery procedure tonight. That's the 10:15 difference, so be sure to tune in for that. Thank you so much.
Thank you for having me.
Appreciate it.
Thank you.